I first wanted to become a physician because I was interested in discovery. So I actually entered the medical field mainly as a researcher. But then eventually I became more interested in clinical work. And since probably around 2005, I've been predominantly spending time in the clinical arena. I think if you had to say who first pushed me towards medicine, I think it was predominantly my parents when I was younger. They're both medical school teachers or professors, and they influenced me to become interested in medicine through that. At the Reedsburg Area Medical Center, what my role is to be a consultant in cardiology. So if people have heart problems, and the family practice physicians or nurse practitioners or physician's assistants, if they feel that they need some further advising on their patients, they'll consult me, and then I'll either provide consulting advice only or provide care for the patient who has heart problems. I think what I found most rewarding about my career is sort of twofold. One is working with people so that I can teach them. Here at Reedsburg, I have a great opportunity to teach our nurses and our nurse practitioners, all people who are committed and interested in caring for rural patients, and also teaching patients. So the teaching aspect has always been an important part of the satisfaction I have from being a cardiologist. But the second aspect is really to see how my patients and their families respond to the therapeutic measures that we make. I've developed relationships with large numbers of people in this area, and I've found that the patients here in Reedsburg, they all want to work and they all want to contribute to society, and I feel like it's a good group of people who are frequently motivated to do better for themselves if they can. And so I think it's a very rewarding group of people to work with and care for. The nurses that I used to work with in Madison, as well as the residents and stuff, they all used to joke that I don't have any hobbies, but I actually do have some hobbies. I do play the piano. I also like to ski. So I do some things, but in terms of on a regular basis, I pretty much like to care for patients. I'm excited to be here in Reedsburg. I'm excited to care for rural patients, and I'm hoping to cure the problem of rural specialists in general. But I first have to figure out how to best do it here in Reedsburg.